will introduce the application of EHR in healthcare system this week. The electronic health records, EHRs, is a collection of electronic health information about individual patients. It can be shared across different healthcare settings and connect to different companies' information system. In the records, data is in a comprehensive form. As for the advantage of the records, the first one is that it presents a comprehensive picture of patient's condition. In complex clinical environment, it helps different people in different ways. For example, administrator can obtain the billing data, and the nurse can report adverse reaction. The second advantage is that it can resolve many vocabulary variations with a structured vocabulary system to share data. The process and mechanism is that a system user allows access to the files, and then the files will be identified for sharing, and at last, it will be integrated with other files. In conclusion, the electronic health records increase efficiency, reduce costs, and solve many problems in the healthcare system.
So within the first article, they talked about computerized physician order entries and EHRs. So one thing that really surprised me about the CPOEs is that only 4% of US hospitals are using this system within their everyday routine. As I was reading about the system and how clinicians are able to order labs and just get all these patient results within the system, I was really surprised that so few hospitals were integrating the system within their everyday routine. But one concern that was brought up was the dosing calculators and how they they bring up new errors that aren't there when you're manually calculating the dosage for patients. So I feel like if the calculator can somehow be fixed to standardize it with how doctors manually do the calculations, then this system and integrating it within the whole healthcare industry can really change and innovate the way that we interact with labs and pharmacies and radiologists. I just think it would be really good to kind of integrate technology within the healthcare industry. And then with EHRs, this was something that was brought up, how it can improve the healthcare industry and kind of transform it in a way while also reducing costs. But one of the main concerns was that privacy and security isn't really a guarantee within the system because so many people have access to the patient information. So I feel like if there was a way where we could restrict access to only the doctors who are interacting with the patients, this would also be something that's very innovative for the healthcare industry and something that can really transform the way that patients can interact with their own health.
So the second article talks about CPOE and the fatal errors that can occur with this. And basically CPOE stands for Computer Physician Order Entry. And it's basically the process in which physicians send in medical orders or treatment instructions electronically via a computer application rather than writing it on paper. For example, if you go to a doctor and you want some medicine, they write it down and they give you the paper. This eliminates the idea in which you just get the paper electronically. The reason we have this is because sometimes when a doctor writes your note, it's very hard to read, and so this eliminates that idea that there can be an error because you can't read the writing. And so it focuses on how the fatal error occurs. And for the past few years, there has been an overall 39% of harmful drugs that were administered, and about 13% of those were from medical orders. And so the problem with this is that even though we're trying, CPOE is steadily improving, we need to work harder to increase it because people are still receiving the medicine that can kill them and they don't know that it could because they didn't get the correct instructions or the CPOE doesn't line up and they can't do anything about it.
and also advised that hospitals work together with the IT vendors and clinical leaders to improve the medication reconciliation and also avoid foreseeable errors. However, U.S. hospitals that meet leapfrog standards for the CPOE implementations have improved drastically from 2% to 96%. As doctors have become more dependent on using information technology to take care of patients' medication orders, many errors have still been brought up due to the lack of experience with the CPOE system. However, with time, the CPOE implementation have been getting better and now is used by many US hospitals. I learned that information technology implemented into the healthcare system does take time for people using it to adjust to it, and it is important to learn along the way and fix issues when using a new information system.